gentlemen, good evening from Center on Integrated Rural Development for Asia and the Pacific, CIRDAP. My name is Chersak Virapat, Director General. This is the second webinar series in 2021, and this can be made possible with contribution from experts of the Center of Excellence that we have created. And I'd like to welcome all participants. I hope that you find this platform useful for knowledge sharing across interdisciplinaries. And I would like to take this opportunity to express my sincere thanks to Professor Nuanchan, Singkran, Mahidol University, and I look forward to collaborating with her on our future webinars. I think that I will stop here and back to you, Huren. Thank you.
Thank you so much, sir, for your speech. Now, before starting the webinar, I would like to say something about our organization. As you all of know, the name of our organization is Center on Integrated Rural Development for Asia and the Pacific. It is an intergovernmental regional autonomous organization, and it was established back in 1979 with the initiative of the countries of Asia Pacific region. Currently, we have 15 member states, and Bangladesh is the host country of this organization. All these 15 member states, we have designated contact ministries and link institutions through which we promote regional cooperation on integrated rural development. And since the establishment of this organization, CIRDAP played a very significant role in improving thousands of lives of rural people in the Asia and the Pacific region. And next, I would like to talk some of our future upcoming webinars. The next webinar will be held on 27 September, which will be facilitated by Dr. Vasanthi Rajendran. She is from Rajiv Gandhi National Institute Youth Development from India. And the topic is Indian Youth Development Index and Global Youth Development Index with particular reference to CIRDAP member countries. And after that, there will be another webinar on issues of agricultural extension service in India, which will be held on October 3. And then we will celebrate International Day on Disaster Risk Reduction, which is October 13. On that day, we will organize a webinar on disaster management in Bangladesh by Professor Dr. Mahidol from Buet. And there will be, after that, the 15th October is International Day of Rural Women. So last time we also celebrated these two International Day in 2020. So again, we will celebrate these 2 days. But the webinar will be held on 17th October as 15th October is a national holiday in our country. So, and then there will be a lecture on resilient strategies for aquaculture and fisheries to face the extreme shocks. But the date and time is not selected yet, but we will inform all of you via social medias and websites and also via email. And the next webinar will be held on 3rd November, which will be hosted one of our member states, Indonesia. It will be an international workshop on village management through village governance of village economic development and empowerment. So next, I would like to talk about our today's honorable speaker, Professor Dr. Nuanchan Singkran. She is from Mahidol University, Thailand, and she is a professor in Faculty of Environment and Resource Studies. Dr. Singkran completed her PhD from Cornell University, USA in 2007. She is a permanent lecturer since October 2012 in Mahidol University. Beside her working experience in the related fields of aquatic ecology and modeling, Nuanchan's research interests are oil spill modeling and management, flood risk management, and material flow analysis in diverse systems, and city metabolisms in relation to urban development and anthropogenic influences. If you want to know more about her, you can go through our website. There is a CIRDAP expert database. You can know and you can learn details about Professor Dr. Nuanchan Singkran from over there. Next, it is today's webinar title, The Pandemic Disease Prediction and Management, a case of the outbreak of COVID-19 in Thailand, which is very much related in today's world situation, in the pandemic situation. And now, lastly, I would I would draw attention a quick few points from all of you. Kindly just let us know in our chat box, where are you from, your organization, your name and designation, your institutions. You must have question or opinion or suggestion after the presentation or about our presentation or about our webinar. You can drop those suggestion, opinion and question in the chat box. So after the presentation, after end of the presentation, I can ask those on behalf of you, I can ask those questions to our honorable speaker. And also just kindly mute your audio because to remove the background noises. And then CIRDAP has LinkedIn page. You can follow in the social media, or we have Facebook page, Twitter, and also we have a YouTube channel. You can just kindly subscribe to our YouTube channel. And lastly, you can visit our website www.cirdap.org, where you can get every updated information about our future webinar activities, research activities, and etc. So thank you, all of you, for bearing with me. Thank you. Sir, do you, I would like to ask Dr. Charsak Birapat if you have anything more to say, sir.
No, I think that you will invite the speaker, right?
Yes, if you
please,
okay,
please,
if you
please,
okay.
please give time to speaker.
Yes, okay. Now I welcome Professor Dr. Nuanchan Singkran. I hope, ma'am, I pronounced your name very correctly, because I'm. Is it okay? Okay.
Yes.
Okay.
Correct.
Thank you, ma'am. Thank you, ma'am.
Correct.
Yes. So now over to you, ma'am.
Okay. Thank you so much. Okay. To save time, I just would like to go right to my presentation. So I start to share screen now.
Yes, I have give you the permission. You can.
Yeah, I already share now. Okay.
Okay.
Yep. Okay. I hope everyone see my PowerPoint here. Okay.
Yes.
And I would like to say hello to everyone. And I just to start my talk tonight that cover both prediction and management of COVID-19 in Thailand. So it may be a lot of the numbers, but okay, that is the case. But please stay with me until the end, because I have only 13 slides. Okay, it's not a lot. Okay. And my presentation is divided into three topics. The first one is about the summary of the outbreaks in Thailand. The second one is about the prediction and trend. And the last one is about the pandemic disease management. Okay. Here is the overall what is happening in Thailand last year and up to now. Overall, this is the overall the pattern of the COVID-19 outbreak in Thailand. Is I divided into 4 outbreaks. Okay, the first outbreak was from this one. You hardly to see here because it's very small number of the infection here. Anyway, it starts from the January 12, 2020 last year to December 14, almost the end of the 2020, and the total infected cases were small. You see, is about 4,000 cases and only 60 days. You can see that. But after the first wave, we start to have the next wave, it's called the second wave. I will explain you later why, which reason I divided into each outbreak. Okay, for the second outbreak, okay, is that start next to the first outbreak from the December 15 that year, but until April 4th this year. Okay, and the increased number of the infection up to 24,000, more than 24,000 cases. And but the death is still low. You see, the death only the 35 cases. But what happened after that? You can see here the picture, the curve here. See here for the third outbreak, next to the second outbreak from April 5th this year until the June 27, we had like more than 200,000 cases, and the death is come up to almost 2,000 deaths here. It's not stopped yet. Until now, what happened? I hardly to believe that in the first outbreak here, it starts from the June 28th until present. Now we have the infected case more than 1.1 million. And the deaths now up until today is more than 13,000 deaths. Can you believe that? This very fast. Okay, what happened for the first week, for the first outbreak? The first one is even is the beginning, but with a lot of the preparation. For the first outbreak here, we have the flow group of the super spreader. At that time, we call it super spreader. Okay, we don't have a cluster now. For the first time, we have 4 super spreader. The first group of people who gathered in boxing stadium in Bangkok. I think you know Thai boxing, okay? It's in the Bangkok, and we have some big boxing stadium that a lot of people who like boxing, they will go there. Okay, the second group is a nice visitor at the entertainment present in Bangkok. Okay, and the third group with workers who return home in the countryside after we curfew in Bangkok. They have nowhere to go, so they just come back their hometown in the countryside. So, but they don't go alone. They carry and they go with the COVID-19. It's kind of the transmission to the countryside a bit at that time. And the last group of people who came from country that faced the outbreaks. Because at the first outbreak, we don't have a lot of cases, as you see my graph before, but we have some people who came from the other country with the COVID-19. And the original variants of COVID-19 that time is the Syrian, it is from the Wuhan, China, okay? And the peak, the infected peak is just 188 cases. Very small compared to our infection rate today now is more than 10,000, see? And, but it's last the many days, you see, it's almost a year, 338 days is last for this outbreak. To deal with the first outbreak, the Center for the COVID-19 Situation Admission of Thailand, chaired by Thailand Prime Minister, was set up, okay? And the emergency decree was announced on March 25th last year, and it has been enforced until now with specific adjustment over time, okay? Curfew were applied for several short time period for the first outbreak, even it's small, okay? And state and local control were used to contain people who came from other countries, and social distancing were applied inside the country. Okay, these are a lot of things happen for the first outbreak. And at that time, I view the SIQR population model. I will not go into details about this kind of system dynamic model because this is not a lecture about the modeling, okay? So I just tell you what I did, okay? And for the first time, the model is is very good, okay? To capture the infection pattern here, okay, with the prediction efficiency about the 82% here, and this we call the peak here. That is the 188 cases here. After that, is decreased by the end of the April, okay, April in 2020. At that time, we have the infected case between 0 and 1 plus some the infected people from the other country, okay, until the end. Okay, this is happened in the first outbreak of the COVID-19 in Thailand. But for this one, for the second outbreak, now we call the transmission, the spreading source of COVID-19, and we call it the cluster, okay, the major cluster. We had to believe that we have the major cluster at the end of 2020. Before that, we thought we already done the manage like that with the COVID-19. People come, you know, out of their house and do everything almost the same. But we had to believe at the end, in the mid-December last year, we found the big cluster, you know, of the fishery worker at the Chimlap and the Central Chim Market in Samut Sakhon province. This is just a few hours from Bangkok. It's located on the west of Bangkok. It's very close to Bangkok, okay? And right after that, you know, the transmission went through the network fresh market almost across the country. Anywhere that you have the fresh market, they have the social network, you know, they go to the Central Chim Market and they buy things and come back to their own markets. Anyway, that they carry the COVID-19 with them, okay? That's not enough. After that, we have people who came back from the Thakhilek city of Myanmar. Myanmar is located above Thailand, okay? They come, we have the Thai-Myanmar border, so people can travel back and forth, you know, and they come back to Thailand with some kind of the, you know, infection, okay? And we do have another group of people who came from camping place in Rayong province with COVID-19. And the variant in this outbreak is different, okay? This is like the GS variants of COVID. It's not serine, okay? It's not the original one that we got from the China, okay? This is a variant, is the GS, okay? It's a subvariant of G, okay? And the peak is increased just from the 100 and more up to almost 1,000 for the second outbreak here on January 26. And it's last shorter, you see, it's last only the 111 days for this period. And for this outbreak, okay, we the government, the Thai government add more the measure like we close down the Central Chim Market for the short period. We have the curfew in Samut Sakhon province, and we do use some kind of the policy we call that bubble and seal. What is it? The bubble and seal is a kind of the, you know, it's a kind of the policy that for controlling activity of fishery workers not to travel outside their routes between their houses and factory. They have to go right from their house to the factory. That we call the bubble and seal. Otherwise, they have to stay in factory to work, something like that. This is the way to limit the areas and reduce the transmission to outside. And we have some few hospitals to build to accommodate the COVID patient with light symptoms. And at the end of the February this year, we we launched the vaccination program, but it's not a lot in the first few months of this year. That's why we have the hard situation now. Okay. And okay, this is the model. For this time, you can see that you can compare clearly. You see, this is the first outbreak here. Compared to the second outbreak, it's totally different. And that's why I said for the first outbreak, I use the SIQR population model. It's very easy to capture because it's only one peak here. But compared to the second outbreak, a lot of the infected peaks occur here. So the same kind of method cannot capture well. So I switch to use the mix. I call that the mixed time series model to predict the outbreak from the second to the fourth outbreak. Okay, and using this kind of model is have some kind of the seasonality and auto correlation that included into the model. This kind of thing can capture the variation of the observed infection in the outbreak pretty well. So I switch to use this kind of the model so that I can predict the trend and what is will happen after that. And some of my prediction was used by the Thai government, okay, for the policy and management the COVID-19 for the fourth outbreak. Okay. Okay. Now we arrive the third outbreak. Okay. The third outbreak happened just like after the second outbreak, because at the end of the February, we said, okay, we can control the outbreak and the infection in the Samut Sakhon quite well, because the case is lower than 100 cases a day. So okay, we let people to join the Singkran festival in Thailand in the mid-April now. So we come up with the same like that we happened before the second week. Okay, like we can pay outside again. If you know Singkran festival in Thailand, so it's a long holiday. People come back home in the countryside, or let them happen. We have a lot of foreign visitors from the other country come to play Singkran here, like that, and that's happened. And we come up with the third outbreak. Okay, so we call that local transmission. Okay, other than the night entertainment places in the Bangkok that is and Thailand is the major cluster. We have the local transmission of the people visiting hometown during the Singkran festival, and when they come back home with the COVID-19, and they, you know, their parents, their own relative, you know, got infection with this virus, and the variants of virus is this outbreak is alpha. Okay, it's different. Okay, these are, if you remember, the first outbreak is Singkran. Okay, the original variant. The second one is a GS. Okay, and in the third one is alpha. Okay, alpha is from England, right? Okay, and the infected pigs is almost 10,000 now. Okay, on May 17. But the duration is lasted only for 84 days. And during this time, you know what happened? We don't mainly measure were similar to the second outbreak, because the Thai government was reluctant to provide more measure, because people getting more, because we have too many measures for the first outbreak. Okay, and now we think we thought, okay, we can control the third outbreak, so no additional measure. Okay, everything is the same. Okay, and no curfew. And this, okay, this is the model prediction. I still use the mixed model, and it still show very high prediction efficiency at 95% confident interval. Okay, but as you see here, You may say, oh, this is the peak. Yes, this is the peak of the most cases. Like this peak is almost 1,000. We have almost 1,000 cases on May 17, and most of them, almost 7,000 cases were from the Python cluster. This is not the daily number, okay? This is the cumulative number of infection from the Python cluster that report at once, okay? So this is a kind of the big data points that the model cannot capture, okay? It's a kind of the outlier because it's not the real number of that day, okay? They have the like the collect the case until they think it should report at once. So my model cannot capture this day, okay? But the rest is okay. And now we almost done, you know, okay? This is the fourth outbreak. We are facing the fourth outbreak, and you see the spreading source chain is from households. Now, from our family, we cannot touch anyone in our family when if some of them go outside, okay? When they come back to our home, you cannot touch your husband, your wife, your children, okay? These are the major source is household or communities, working camps, construction site, factory, industrial, and Python still remain. So this is the major spreading source here. And you know, I think you know this kind of variant, Delta, okay? Delta is almost everywhere now, right? The Delta variants. This we happen in Thailand now. And you see the highest peak we ever had is more than 23,000. I think this is the peak, okay? I am not sure, but I think this is the peak that occurred on August 13, okay, it's already passed. I don't know the future, but I think it is what the peak. And it's still now. And for this time, you know why I am talking here? There is a curfew time in Bangkok and in the highest control area. Now, my husband have to come back home before, you know, 3 p.m., okay? And we have to stay in our house until 4 a.m. This applies from the 1st of August until now, until I'm talking here. It is a curfew time in Bangkok, and there are some like the suburban province in around Bangkok, okay? And now we have the hospital, we have home and community isolation. This is a kind of the places to accommodate the COVID patient with like symptoms, because we don't have enough patient case for COVID-19 in hospital now, okay? This is why we have this kind of thing like that to support, okay? Okay, and these are my model, okay? Actually, I developed the model from the first time on since like 12 January last year and until the end of this year. But every day I have to do this. You will believe for the half day of my life since the COVID-19 come on the 12 January 2020 until now. Every day I have to wake up and run the model, okay? And I have to send the prediction number to some like you know policy maker, some government, okay, for them to have my number and for prepare at least beforehand. And so that's why I put some I put 3 scenarios here. Sorry. The first scenario here, you might see the black line graph here. So there is here is a poor preventive measure with vaccination, because now we have the vaccination program is running, okay? And I count for the cumulative percentage of the second dose. Now we have about 18.5% now. So I did add it into my model for the 3 scenarios here. And for the first scenario, backlight is like the poor preventive measure. But if we don't do anything, we just let things happen like the second wave or the third wave, we might come up with a new peak. It's more than 22,000 cases a day by the end of 2021 or by the end of this year. And for this one, the total infection number may reach more than 3.2 million cases by the end of the year. If we like have a lot of the relaxation, everything go on like for the second, the third wave, okay, the third outbreak. But I think the situation in Thailand is now is consistent with this scenario, okay, moderate measure with vaccination, because now the case in Thailand is fluctuate between 11,000 and 13,000 a day now. So if we keep doing well, we have some why we call that we are in this scenario, because we are open some kind of business, let them to open now, okay, and we even open some kind of some province in the south for the tourism as well, okay. But if we were lucky, we might have the infection decrease to between 6,000 and 8,000 cases a day after December 6, okay, by the early December this year. But if we follow the intensive measure with the vaccination, this one, the about like up here, but I don't think we follow this scenario, okay. We might be able to decrease the infection to lower than 3,000 cases a day after the end of October, okay, after next month, okay. But I don't think so. I don't think we can make it for this scenario. If for this case we will end up with the total infection more than 1.8 million cases by the end of it, but it's still lower than the moderate and poor measures like this. You see, this is the total infection number. Okay, this is a near future of Thailand now. Okay, which one we are in the moderate preventive measure with vaccination. With we are here now. Okay. Why it doesn't move or anything? Okay, I am all done. Okay, so let's see what I have done. So these are my last two slides here. Okay, so I come up with this slide. I think the outbreaks of COVID-19 were a kind of pandemic disease that affect public health and socio-economics. Okay, and you can see indeed like the overlap T circle here. So when you try to manage the situation, you cannot just concern about the public health, but you have to concern about the economics and social aspect as well. So this kind of something you have to concern and to go in the same time simultaneously. I mean, so I propose this. I call it a psychic disaster management that can be used for managing this pandemic disaster in 3 periods. That is before, during, and after the pandemic event. Before the pandemic event here, we have to focus on preparation and mitigation should be ready beforehand. This means before the second outbreak, for the third outbreak, even for before the fourth outbreak, Thai government should have something come up before, after the first outbreak, right? But we don't have anything beforehand for the second, for the third, and for the fourth outbreak. We don't do anything almost a year after we think we had done with the first outbreak. Okay, so we don't have kind of the preventive and adaptive measure. We don't have a course of conduct and practice. We don't have rehabilitation plan, early warnings, and so forth. We have nothing. Okay, after the first outbreak, that is very small. Okay, and during now we are at this process during the pandemic event. Okay, emergency response take place to help infected people. Now that what we can do. Okay, from both illness and socio-economic impacts using several measures. For example, intensive public health measure, socio-economic measure, and vaccination, and on related toolkit like the antigen ATK or antigen test kits. Okay, we think more about what we should do after the outbreak. Okay, it's about the process of the recovery and study. Okay, after the event done, after we hope the COVID outbreak should be done sometime. Okay, after the event, the recovery process must include both rehabilitation of mental and physical health of people who were infected. Okay, and economic status of the infected people. Meanwhile, I think these other studies and risk assessment should be carried out. Okay, again. Okay, this study would be very useful for preparing necessary measures to handle the future pandemic. I think any kind of pandemic can occur again in the future, and we should have some tool or some ways that to educate people, and so that they become an active citizen. Okay, and they if they become the active citizen, they will be able to help to create the social protection. Okay, and adaptive living environment with a future pandemic. So we call that is a kind of pandemic adaptive resilience. Okay, so we know how to deal with any kind of the pandemic in the future, let's say. And you know, and before I will end my talk tonight, let me show you one slide here. Okay, these are some example of the effective COVID-19 management. From the actually there are more countries than this, but I just pick up 3 countries that I like. Okay, as Singapore, Taiwan, and New Zealand here. And if you look their statistics on the worldometers, you will see that their length is on that website is well below 100. Okay, and they're consistent with their low numbers of infection and deaths. Okay, you can see it is very small here. Even it's a high number of infected, but the death is only 58 cases like this. And you see in New Zealand is only the 27 cases dead like that. And other than that, they do have the several measures, right, to be applied. But other than this kind of the measure, I think most of them pretty the same to other countries, right? But I think that I interested in here, the management entity here to deal with the pandemic in this country. I think it's very interesting, particularly in Taiwan and New Zealand, because it's what in like that is include all stakeholders and work across multidisciplinary fields. This is a kind of the integrated disaster management that allow the representative from the government, private from the government agency, private sector, community, and people or citizens to collaborate and came up with the effective management plans. This is the important key of success, not just about the case of COVID-19, but everything, I think. How do you guys think? Thank you very much for your attention. I'm done.
Thank you, madam, for your
Mm.
wonderful presentation. Thank you, ma'am.
Thank you.
Sir,
Now I don't see the question in the chat box. Maybe we can have a live question and answer. So may I invite participant to raise question. I think we have time, right, Huren?
yes,
About,
sir.
yeah, we have time enough. We have 20 minutes.
Yes, 20
Yes,
minutes.
20 minutes. Yes, please. So any question? I'd like
Yes,
to
if I
tell,
may.
yeah, yes.
Yes, if I may.
You have
Right,
to
right.
tell who are you and
Yes,
then you
I
can.
am Ponchai,
Oh, all right, okay.
Secretary General of KCD. Yes, I just would like to jump in order to congratulate CIRDAP, particularly the DG for hosting this webinar, and also for the comprehensive outlook by Ajahn Nuanchan. Thank you very much for her contribution. In fact, I just would like to know, as a layman, of course, whether or not we could expect what we call herd immunity, not only in Thailand but also in the ASEAN member states in total. I mean, in general, not only in any specific country, because we need to have not only cross-border trade, but also movement of people from place to place, and that would encourage more, I would say, travel as well, despite the fact that there could be certain travel restrictions. That is one question I would like to ask the speaker to kindly elaborate on that. The other one is, even though we cannot predict how long we need to live with COVID-19, as some might want to claim that we may have to live with it, if not without, we may have to live with it. Then probably we need to be prepared for other variants. And I don't know how harmful it would be, or sooner or later that we may have to expect more waves, as you call it, fourth wave, or maybe fifth or sixth outbreaks. That is something we need to be prepared as well, particularly in the case of Thailand. We after the success of the Phuket sandbox, the government is planning to open the country starting from, if I'm not mistaken, mid-October onwards. So maybe if the speaker could kindly elaborate more on that, that would be of interest to me. Thank you very much.
Yes, you have to unmute Professor Nuanchan, please. Unmute your microphone.
Okay. Okay. I think you asked me two questions. Okay. The first one you asked about the herd immunity. Okay. I think this is actually I have to say that although I am a doctor, but I am not a physician. Okay. So I may not know well about the immunity, but I read a lot of the physical paper now. Okay, because I have to work on the COVID-19 modeling. I think the most difficult point to get the herd immunity in Thailand and elsewhere, because it's a kind of the special characteristic of COVID-19 that is very easy for them to to change to have a new variants, because and now only the tool that we can reduce the new variant, we have to get the vaccination very quick. Okay, and according to my, if you look at the situation now, even in the United States, today is more than like it's more than 1.6 10,000 cases today of infection in the United States, and more than 2,000 cases were dead. That is the problem. It's about even when they have a lot of the vaccination, but it doesn't cover for the whole population at the same time. Because if everyone don't have the vaccination at the same time, their immunity inside in body keep decaying over time. And if your immunity decay after the 120 days, you have the high risk. You are like exposed to get in touch with the new variants of COVID-19 again. So that is the point. So I think the best way that we might stop to be infected with the new variant, that we have to manage to have our population to have vaccination very quick and as many as possible at the same period of time. If we have for the period of time at this the number of operation, is when over time the immunity decay again, so that is a high risk to get infected. Okay, and for the new variants, you have to follow the WHO, okay, because now they have a lot of the news variants announced on the WHO website almost every day. What kind of the variant that we have to monitor, we have to take close observation about them. And for Thailand, I think this is very high risk at the end of the according to my model. Okay, if you see my model, let I share my screen here again. My model here is a predict here. If you see here, we have poor preventive measure, and here you see this is a start as about the at the beginning of November. Okay, it's maybe in the same time like at the end of October. If we don't have the good preventive measure, the case I come back again, and it may not in like you say, it's maybe the fifth outbreak with the new variants like that. So this can occur if we don't manage our situation very well. That is, yeah. I hope I try to answer your question.
Thank you very much. Thank you. Thank you.
Thank you. Okay. Any question, please? We still have time, 15 minutes. Yes.
Only one thing I can share it. Yeah. First of all, I would like to thanks to CIRDAP to arrange this type of seminar, Werner, and also thanks to Singkran to nicely presented the pandemic situation of Thailand. So I think that the Delta variant is very dangerous before the first and second wave and third wave. So in the global situation, the India, Bangladesh also affected in Delta variant, but there is no characteristic, there is no symptom. Everybody can carry it, and it's just spread it over the country. So every country government takes some measure, especially for lockdown or the movement, social movement, and we see the marketplace or public place or gathering place is very dangerous for spreading the Delta variant. So as far I know, the Thai government will open the Phuket or any visiting places for visitors attractive. It's not dangerous for spreading the COVID. Can I explain my question? The Thai government now declared some visiting places for tourism or international tourists. It's not dangerous for spreading the COVID.
I have to unmute your microphone, Professor Nuanchan. I suggest you turn on all the time your microphone.
Okay. You ask me, is not dangerous? That is your question. Oh, this is the difficult question for me because you know the Thai government agency involved. They think if more than 70% of the population in that area, for example, in the Phuket, they were vaccinated, okay, 70%, and they have to limit the tourist spot, okay. You might go to the to stay in Phuket for a while, okay, and you have to check like using ATK to check if you are COVID free, okay, for the 14 days. After that, if you still are COVID free, you can travel beyond the Phuket area to some like the province like the Trang or Satun, something like that. But for me, you know, if you, I just say that there is no zero risk, okay. there is still some risk everywhere, okay. So I can say that, okay, it's a zero risk and you will be safe, okay, after we open for the tourism. I cannot say that.
Can I say something? Can you hear me?
Yes, sir, we can hear you.
Yes, yes,
Okay,
yes.
okay. First, I want to make a comment, and then maybe a question to Professor Nuanchan again. You have got some information on Singapore, which is correct, but I have to say that we are lucky here in the sense that ours, as you know, is a very small country, small population. So now we have more than 80% which have already got the 2 doses. I have 2 doses already several months ago in April. And I'm now waiting for my 3rd dose. Another 70,000 have already got the 3rd dose, you know. So the senior people like me will get our 3rd dose very fast. Okay, so that's an advantage. And my son, who works in this kind of thing, has said that you will always get death. You get people who are going to get COVID. We can't run away with it. It is like smallpox, chicken pox in the old days. All right, you will stay with us. People will die until the day it will be part of our society, and then the day will come when we say, well, you get COVID. Okay, you're not so serious. Well, it's okay. You get your vaccination every year, you know, that kind of thing. Unless you have other diseases, you know, that's a serious problem. So for example, now in Singapore, we do not look at cases. Our cases have gone up from less than 10 now to few hundreds. Now we are touching 1,000. And our minister has said that we will reach 2,000, but we are not changing our public, what you call lockdowns and things like that. We still have some partial lockdowns, but we have to carry all with us something called a token, you know, something like this. Tracing, you know, you give a beep, you go somewhere, then you come up, you give another beep. Americans who don't like this, you know, but to us, this is perfectly okay, all right? So we have this, you know, so that whenever somebody gets sick, you know, the cluster is identified and you know who gets sick. So that's this social distancing, very important. We all carry masks. You don't you don't have masks, you get fined, you go to jail. You see, so these are all very important things. Okay, so I think basically we have to live with it, and I think we come to a point where we are quite comfortable. All right, we have to change our other things, economic behavior and social behavior. Okay, that's one. Thailand, I think, is a much bigger country. All right. And I think you are hit because, we got hit because of tourism also. But we don't depend on people. We depend on the planes. So at least now our plane has gone back to get about 80% of the traffic in cargo. So our passenger is still very low, in the tens, but cargo is very high. So at least it saves us. So I think Thailand, it experimented, with the what they call sandbox here and there. And I think it is good that you go for high vaccination again among the local population. That's one thing you have to do. You have to do contact tracing. That's why when you come in, you are localized first, check again, that kind of thing, which is good. But a question which I'm going to ask Professor Nuanchan is that your tourism minister has given a date, if I'm not mistaken, 2nd of January. And he said the whole of most of the provinces of Thailand will be open, right? And I'm looking forward, I think Dr. Chesak also is looking forward to see me, that kind of thing. We want to run the course. So what do you think are the prospects by next year, January, February, when Thailand can allow almost what I call free travel tourists to come in, green tourism? That means no more quarantine, but of course, every passenger must be totally vaccinated, must carry some kind of tracing device, or and also what they call medical insurance, I mean, that's to be expected. Travel will not be cheap anymore. It's very expensive now, you see. So what are your comments?
Okay, thanks for your sharing your experience and your opinion about the Singapore and what I have done about the COVID-19 in Singapore. I do agree with you 100% about the social distancing, keep wearing masks and use alcohol gel. It's a kind of thing, and it's a kind of we call that the new normal. So I think because some of my relatives, they are old, and they cannot get vaccination at all because they have some kind of the personal disease that is not good to have vaccine. So, but they still stay safe because they keep the social distancing, and they have very good self protection and adaptation, okay, to live in the new environment, okay. So I think this is the most important thing and more important aspect that we are human beings have to learn and to accept and to try to adapt to live in the new world of the high risk to face with any kind of pandemic in the future. So that's why I think we should come up with a kind of the adaptive measures or the kind of the course of conduct or practice that will anyone can understand easily and follow that, and we are still safe. And why we would like to do some kind of activities. For your question, is it possible to open the Thailand to have the people come to visit Thailand next year? Oh, you have to ask my Prime Minister, Professor. I cannot. please.
Okay. In fact, I'm going to Thailand in beginning of January. I hope that Thailand will not have 14 days quarantine. I already been back to Thailand twice, and I have to pay once and another one by state quarantine. So I hope that my next time I will not have to be in the quarantine. I think that several questions has been asked already. I trying to play with the figure because you show me the figure. I trying to play, but I could not get anything significant. But I only compare between Thailand and Bangladesh that the population density in Bangladesh is very high, you know. And I arrived Bangladesh in the end of May. At that time, around 15,000 cases a day. And Thailand is less than that. Thailand is about 10,000. And then later on, Bangladesh reduced now to 2,000 a day. But Thailand go still 13,000 this morning. So I'm trying to answer myself why. And Bangladesh, I I went outside from my condo to my office. I saw many people do not wear masks, and I expect that they may already got COVID and they have immunity. They are not fear of COVID anymore. Those young people mainly walking without masks, and they don't get COVID. Um, I went to my office and for many meetings that we have internal meetings. I take off my mask for photograph, and many people saw me in the picture, and they said, "Don't you? Aren't you afraid of COVID?" I said, "Just shortly." And anyway, I trying to look at myself and prevent myself before taking photo. I asked my staff to be quiet, not to speak, and so that I'm still survive at the moment, no COVID. Okay. I think that if you have any more questions, please. I saw the embassy of Philippines would like to ask question. Maybe we can take few questions, please. Philippines is not here. We have Pakistan High Commission. Any more question? If not more question, I will have to conclude. Please. Oh, Philippines. Yes, please.
Yes, sir. Hello, I am Leo Vidal from the Philippine Embassy. Thank you, Professor Singkran, for such a very comprehensive presentation. And looking at the data, I see that there are a lot of trends because I am currently monitoring 3 countries. I am monitoring here in Bangladesh. I am also monitoring some of the countries under our jurisdictions, which includes Sri Lanka and Maldives. And of course, now I also got the data from Thailand. And I think from all that I've seen here and in the newspapers, there are a lot of parallels among all these countries. And the trends are the same, the measures are the same, they actually come into effect at the same time. And the people are, the studies all comes out at the same time, and they have consolidated studies on these ones. So, but my question is, we have lots of data. We have a lot of academics who's doing this data. We have lots of uh, um, medical centers, I suppose, and medical researchers and all that doing all this data. But are these data even being properly appreciated by the policymakers, two, maybe the media, and three, the people? Because we can have all of these kinds of data, but I do think that they are not being properly either there is some form of disconnect, they are not being properly appreciated, or these are not being very well understood. I mean, I don't know where that disconnect. They may not even reach the right kind of people. I mean, so I would really want to know if where is that problem? Where is that challenge? Because as I said before, we can have all these data, we can have all these studies, but if they are not properly appreciated or if they do not translate into policy, then what's the point of having all this data? Thank you very much. I may have another question later, but I'll give them one by one. Thank you.
So I think you asked me, right? Okay. You can hear me. Okay. Your question. Let me conclude your wrong question into a little bit short. Okay. So you ask about your for example, my modeling data, or even my community. This my government or the policy maker have been used this or employed for the to make a thing that are useful for the people, for the public like that. I say for my data, yes. Okay. I didn't intend to do this job to please the Thai government, but it's my own interest, you know. If you are a lecturer like me, you will do things that you love. So that I keep doing my modeling every day, and I keep sharing my modeling prediction to just my close friend and people that if you have come close, and I don't just share my model, but I just share my opinion, my the prediction interpretation for them, and let them to understand. I did it from the first outbreak in Thailand until the third outbreak, at the end of the third outbreak, and the fourth outbreak, the big outbreak is almost coming. So I send my message to the Thai government. I send the fourth outbreak is coming. If you don't do this, do that. Believe me, this is will coming. Please take my prediction for your close consideration. You know what happened? I don't know why they took the whole of my prediction and result, and they come up with the curfew. They come up with the curfew now, until now. They use my prediction and say, if we don't do anything serious, if we don't lock down, if we don't have the curfew in Bangkok, in the suburban area from the 1st August, okay, let's say for the 15 days. Now look at your Professor Nuanchan prediction here, and he showed my prediction here. Okay, it's just to make the curfew, okay, but it's still okay because in the next day, my prediction number is published on a major newspaper. And I was very, I have a problem after that. I don't have time to work because the news reporter came to me. So I said, don't, I have to prepare myself for getting to be look so nice on TV, I never have done that before. So that I don't like that kind of condition anymore, actually. So I think, actually, I don't expect the Thai government to use my prediction data for and the curfew, okay? But I would like the Thai government to use my data just to do something that even more progressive than that, okay? Just to come up with some kind of the clear course of practice conduct, so that to make sure that we are ready to open our country, to make sure at least 95% confidence level that we can open our country to welcome everyone like that. Okay.
Thank you very much, Dr. Singkran. I think I got the gist of the problem from there. It's I think and it parallels a lot of the things that I read also, that governments may have all these measures, but even the most advanced ones, the problem is always people not listening to the experts. So you can have all these resources, but if your policymakers don't listen to the experts, or they don't translate the words of the experts into something that all the people can understand, then no matter how many resources you have, no matter how many measures you put in place, it will all really won't take a hold in making a lasting impact in the crisis. And it's really a very difficult job for us diplomats, who are the intermediary between the experts, policymakers, and the ordinary people, to make these kinds of things easily understood by everyone, and to be the focal point of information in a lot of instances. So thank you very much for that, Dr. Singkran. And I think a lot of the burden are really on the scientific and on the educational communities to make, not only to do these studies, but to make them more understandable to everyone else. Okay.
Okay, thank you
I
very
guess
much.
that's it for me. Thank you very much, DG Virapat.
Yes, thank you. I see another questions after Philippines. I think that you kindly put some question in the chat box, but I see another question from Miss Maicha. I think that if we could take it as the last question, maybe. Professor Singkran, do you see the question? May I read it? Would like to ask, we saw from the first slide, the spread are likely to remain upward. So when you are getting the prediction results and outcome from the model, are these results controlled for any logistic action taken by the authorities, such as limited social interaction, vaccination, with more control prediction? Are the results supposed to remain same or decrease at the year end? I think that you already explained something about that. I don't know, Maicha, satisfied with what Professor Singkran has explained about that?
Yeah,
I
I can add more about this.
Okay.
I think recently I suggest the Thai government the pollution control from the public health from the disease not pollution control, sorry, from the disease control department, okay, of the public health ministry, okay, to like give the ATK to the households, to the people for free, because this is the
ATK is antigen test kit.
Yeah, for free, okay, because this is another kind of tool that people should have at home for free, don't to buy, because some people, they don't have a lot of money or income to buy things like this. It's a kind of extra, okay. So but now I observe that the government agencies start to give these test kits ATK to the community for free now. About the first period of time is about 8.5 million, okay, test kits to the crowded communities across Bangkok, and in some like the tourist spot, in some like the high risk area like that. Okay, this is the kind of thing that I think there are sometimes the people, like the government people, listen to us, but I agree that some kind of the study, particularly about the modeling, is usually difficult for people to understand. But now I try to learn how to make things to be easy when I have to talk to the media or to the news reporter, even to the policy maker, and to make them understand what I am trying to say, or try to tell them about how to prepare or to manage. But it takes time to learn from each other, okay. But this is happen, okay. It's normal, okay. We have to accept this, okay.
Okay. Thank you so much. I just want to add that In fact, Professor Nuanchan Singkran has been behind the scene almost a year, working every day for modeling and supply this result of modeling to what we call the CCSA Center for COVID-19 Situation Administration. So she worked behind the scene in the presentation by this office every day to on television. But once the number of cases peak on 13th of August, the media start to know that the prediction of this center become quite accurate. So they worry about the situation because they look at that time, maybe the case will be higher or lower. So that's why her name was given to the media by someone from this office, I think. And so after that, she is busy with them. I attend one of her interview, and I note that the interviewer asked her several questions in a way that she should know some future outcome, but she cannot tell them like that. So she just keep them on scientific basis and understanding, because this issue, I myself have been involved with disaster management, but those are natural phenomenon that you could be able to see them. But this one is you don't see them, and they are in human body. So this is make it more difficult. And I have question, but I can ask Professor Singkran later on through my communication, because I think we need probably to look into more on the prevention, on the preparedness and prevention and individual protection that will save you, because you avoid contact to many people, and this kind of thing can help prevent the spreading and outbreak of the disease, I think. So I trying to discuss with the expert in the group that we need a kind of standard operating procedure for individual in different places, and that will help reduce the case. Okay, I think that everyone, distinguished participant, ladies and gentlemen, you find this kind of webinar useful, and I can see that you have several questions. I think will be more questions if we extend the time, but we can because at the time now is in Thailand is almost 9:30 p.m.
Yes.
And today is a work day, so many people just finish work and return home. So you are tired now. So anyway, you can connect to Professor Singkran by email, or we provide you on the website in the expert database, so you can contact her. And I think I'd like this second meeting also, because I don't know, when I attend the first meeting, we collaborate with teams and CBI. We don't see everyone's face. We only see the speaker face. Now we see everyone's face. I don't know, maybe consensus with you. Do you like this kind of interaction, or you want to have a separate screen of speaker, but you don't see the participant? So I would ask the audience if you prefer which type. You can let me know about that. And next time when we upgrade our system, we will trying to follow what you suggest. So for today, I think it's a very good time, and I like to express my sincere thanks to Professor Singkran for her time and contribution. And we will have the next webinar series as mentioned by Ms.
27th.
Janet on the 27th of September.
Right, sir.
And we will try to plan with expert Center of Excellence to plan for next year. We'll bring all the emerging issues that you are interested in, and perhaps we will try to provide information prior to the webinar so that you can access to the information prior to attending this, and perhaps to have questions and so on. So now for today, I think you have a good evening and have a good time, and thank you so much for your attention on this webinar, and look forward to meet you next time. Thank you very much.
Thank you.
Thank you.
Thank you.
Thank you. Thank you.
Thank you, sir. Thank you all.
Thank you very much.
Thank you very much.